Understanding clinical trials. What follows is a consent form for a trial that is not being carried out right now, but for which you might be eligible if it were. Each page will include narration. Following the narration, please take all the time you would like to review the text, and then proceed to the next page when you're ready. The title of the research study is a randomized Phase 2 trial of paclitaxel plus androphylline versus paclitaxel plus oncoprane as first-line therapy for locally recurrent or metastatic breast cancer. The principal investigator is Dr. Johnson, and the sponsor is WinCor. Why am I being invited to take part in a research study? You are being asked to take part in this study because you have breast cancer that has spread. What should I know about this research study? Your participation is entirely voluntary. You do not have to be in this research study. If you join the study, you can stop or leave at any time with no changes in the quality of the health care you receive. You will be told about any new information or changes in the study that could affect you. You can ask all the questions you want before deciding if you want to be in this study. Why are we doing this research study? The purpose of this study is to test an experimental medication called androphylline. We want to find out if it works and test its safety. We want to compare the effects, good or bad, of combining paclitaxel with androphylline versus paclitaxel with oncoprane, an already approved medication combination used to reduce the risk that cancer will occur. Oncoprane is commonly used for the prevention of new or recurring breast cancer. However, it does not help everyone. Androphylline works in a somewhat different way from oncoprane to inhibit cancer cell growth. WinCor is the company that created and makes the experimental medication androphylline and other medications. Androphylline has been approved by the U.S. Food and Drug Administration for use in the treatment of patients with other forms of cancers, but has not been approved for treating patients with breast cancer. How long will the research last? You will be in this study as long as your disease is improving or remaining stable, and you are not having serious side effects from the treatment. We would like to keep track of your medical condition for 5 years, from the time you begin treatment in this study, to look at the long-term effects of the treatment. How many people will be studied? We expect that 70 people will be in this study at UMass Memorial Healthcare out of 685 people in the entire study nationally. Will I definitely receive the experimental medication? No. In addition to the standard chemotherapy paclitaxel, you will either get the experimental medication androphylline or you will get oncoprane, an approved treatment sometimes used to prevent the spread or recurrence of your type of breast cancer. The decision to give you paclitaxel and androphylline or the approved treatment combination will be made by chance, like flipping a coin. Neither you nor the study doctor will choose what you get. You will have a 50-50 chance of being given androphylline or oncoprane along with paclitaxel. Neither you nor the study doctor will know which medication you are getting. In an emergency, a doctor can find out what you are taking by calling the on-call investigational pharmacist. What happens if I say, yes, I want to be in this research? You'll have the following tests to see if you meet the requirements for being in the research study. If you've had some of them recently, they may not need to be repeated. That would be up to the study doctor. You'll have a health review where we'll ask about your health, lifestyle, sleep habits, and any illnesses and medicines you're taking. We'll check your weight, height, blood pressure and pulse, and measure your waist, hip, and neck size. We'll draw blood from a vein for lab tests, and you'll be asked not to eat or drink anything other than water whenever possible for 9 hours before most of these blood draws. We'll take a urine sample for lab tests. If you're a woman and can have children, a urine or blood test will be done to see if you are pregnant. If you are pregnant, you can't take part in this study. We'll take an overall assessment of the impact that your breast cancer and other factors have on your daily life. You'll have a mammogram and physical breast exam. What happens during the study? Eligible participants will be randomized into one of the study groups, Group A or Group B. If you are in Group A, you will receive paclitaxel as an infusion in a vein every week for 3 weeks, followed by a 1-week rest period. Each 4-week period will be considered 1 cycle of therapy. You will continue this treatment for 4 cycles of therapy. In addition to the infusion, you will be given a supply of tablets of the experimental medication androphyline. This will be taken once a day with food according to instructions. If you are in Group B, you will receive paclitaxel as an infusion in a vein every week for 3 weeks, followed by a 1-week rest period. Each 4-week period will be considered 1 cycle of therapy. You will continue this for 4 cycles of therapy. In addition to the infusion, you will be given a supply of approved medication used to treat your condition, oncoprane. This will be taken once a day with food according to instructions. For all patients, you will be asked to complete a questionnaire at the start of treatment, and again at week 17 and week 33, and then every 3 months for the remainder of the study, to see how your disease and the treatments are affecting your life. You will be asked questions about your symptoms, daily life, and any help you may need in taking care of yourself. You will receive a complete physical examination, including checking your blood pressure and pulse. We will draw blood from a vein for lab tests. You will be asked not to eat or drink anything except water, if possible, for 9 hours before these tests. You'll have mammograms, a CT scan or MRI, urine tests, and chest x-rays. What happens after the study? After you take the last dose of the study medication, you will need to come to the clinic for a follow-up visit during weeks 17 and 33, and then once every 3 months for the remainder of the study. If you permanently discontinue treatment prior to the end of the study, then research staff may follow up with you by telephone or other means about every 3 months until the end of the study, unless you withdraw consent. Each phone contact will take about 5 to 15 minutes. After the entire study is finished, all the people taking part have finished the study and all the effects of androphyline, both good and bad, have been compared to oncoprane, we will be able to tell you which study medication you took if you desire to know. Below is a schedule of study appointments and procedures. In the left-hand column, you'll see a list of all the procedures that you'll be asked to do during the trial. The top row lists all of the times you'll be contacted while in the study. A check mark tells you what procedures will happen at each visit. Please take all the time you would like to review it, and then scroll to the next page when you're ready. What are the risks of being in this study? Risks of the experimental medication include the following side effects of androphyline, which have been most commonly reported: hot flashes, leg cramps, flu-like symptoms, joint pain, sweating, or difficulty falling asleep or staying asleep. Other rare but serious side effects could occur. Call your doctor right away if you have severe leg pain, feeling of warmth in the lower leg, swelling of the hands, feet, ankles, or lower legs, sudden chest pain, shortness of breath, coughing up blood, sudden changes in vision such as loss of vision or blurred vision, or allergic reactions. Risks of the standard medications include the following side effects of paclitaxel, which have been most commonly reported: low blood cell counts, mild to severe allergic reactions, numbness and pain of the hands and feet, hair loss, muscle weakness and muscle loss, or muscle and joint aches. Other rare but serious side effects could occur. Call your doctor if you experience irregular heart rate, nausea, vomiting, or diarrhea, fatigue, headaches, yellowing of your skin or eyes, confusion or mood changes, dark urine, or seizures. Risks of the standard medication include the following side effects of oncoprane, which have been most commonly reported: bone pain, joint pain, or tumor pain, swelling in your hands or feet, decreased sex drive, impotence, or difficulty having an orgasm, headaches and dizziness, or thinning hair. Other rare but serious side effects could occur. Call your doctor if you have sudden numbness or weakness, especially on one side of the body, problems with vision, speech, or balance, chest pain, sudden cough, wheezing, rapid breathing or fast heart rate, nausea or loss of appetite, pain or pressure in your pelvic area, easy bruising or unusual bleeding, flu-like symptoms, dark urine, clay-colored stools, or yellowing of the skin or eyes, or allergic reactions, which may include fever, chills, rash or hives, or difficulty breathing. The risks of having blood drawn include slight pain when the needle is inserted. You may develop a harmless black and blue mark, and your arm may be sore. Occasionally, some people feel dizzy or lightheaded when blood is drawn. They may become sweaty, feel cold or tingly, and may faint or throw up. Risks that are possible but unlikely include infection, nerve damage, and puncturing an artery instead of a vein. You will be exposed to radiation as a result of the CT scans. These scans give detailed images of the inside of your body. The amount of radiation a person receives during a CT scan is moderate. We know that radiation is harmful, but the risk to your health is hard to measure. If you have had many X-rays or scans, or if you might be pregnant, you should ask the study doctor about this risk. This is the first time the experimental drug is being used in combination with paclitaxel. For this reason, we do not know all the possible side effects, and we do not know how frequently they might occur or how serious they might be. Thus, unanticipated side effects may occur. An additional risk of being in this study is that your personal information could be lost or exposed. This is very unlikely to happen, and we will do everything we can to make sure that your information is protected. What are my responsibilities if I take part in this research? If you take part in the research, it is important for your safety that you follow the directions of the study doctor and research staff. Tell your other healthcare providers that you are in a research study. Tell your study doctor and staff about all medications you are taking and all of your health issues, and do not use illegal drugs or incorrectly use prescription medications. Will being in this study help me in any way? You may not benefit directly from being in this research study. We hope that androphyline, if you are assigned to receive it, will block one of the hormones required for cancer cells to grow, but we cannot promise that this will happen. However, we hope the information learned from this study will benefit other patients with breast cancer in the future. Will being in this study cost me any money? There will be no additional cost to you from being in this research study. The medicines, clinic visits, and tests that are done for research purposes will be free. Any cost for the standard treatment of your condition will be billed to you or your health insurance. What happens to information about me? We'll try to limit access to your personal information, including research study and medical records, to people who have a need to review this information. We cannot promise complete privacy. The UMass Institutional Review Board, the study sponsor, and the U.S. Food and Drug Administration could inspect our research records to assure the study is being carried out appropriately. Your name will never be used in any results of the study that are published. If you test positive for HIV, hepatitis B, or hepatitis C, these test results will be reported to the local Board of Health and Massachusetts Department of Public Health as required by law. What happens if I'm injured because I took part in this research? If you're injured while in the study, seek treatment and contact the study doctor as soon as you're able. If you're injured or have any harmful effects as a direct result of the administration of androphyline or any procedure required by the research, necessary medical treatment will be made available to you at UMass Memorial Medical Center. The sponsor, WinCor, will pay the reasonable and necessary medical costs for study-related injury that are not eligible for billing to your medical insurance. To pay these medical expenses for a research injury, WinCor will need certain information about you, such as your name, date of birth, and Social Security number. This is because WinCor has to check to see if you receive Medicare. If you do, WinCor must report the payment it makes to Medicare. WinCor cannot use your information for any other purpose. WinCor has no plans to pay for medical expenses for injuries that are not directly related to your research participation or that are caused by the natural course of your disease. WinCor has no funds set aside for any additional form of compensation in the event of a research injury. You do not give up any of your legal rights by agreeing to enroll in the study. Will I be given any money or other compensation for being in this study? You will be reimbursed for your time, travel, and other expenses associated with this research study. You will be paid $75 at each clinic visit. In addition, free parking for all scheduled clinic visits will be provided to you during the study. WinCor will be the owner of the study data. WinCor plans to use the results and may obtain patents or sell the medication in the future or make profits in other ways. However, you will not receive any additional compensation. What are my other options? You do not have to be in this study, and you can stop participating at any time. If you decide not to be in the research now or later, it will not affect your usual care and it won't be held against you. Instead of being in this research, you may continue to get regular care from your doctor, which may include being prescribed paclitaxel and/or oncoprane, or you may decide to have no therapy at this time with care to make you more comfortable. Talk with your doctor about your choices. What happens if I say yes, but I change my mind later? You're free to leave the study at any time. There are no penalties and you do not lose any benefits to which you are otherwise entitled. Below is a list of procedures for withdrawing from the study. Can I be removed from the research without my permission? The person in charge of the research study or the sponsor can take you out of the study even if you don't want to leave. This may happen if the investigator decides that continuing in the study would be harmful to you, if you need treatment not allowed in this study, if you fail to keep your appointments or take the medications as instructed, if you become pregnant, or if the study is canceled by the company making the medication, the FDA, or the UMass Institutional Review Board. Whom can I talk to? If you have questions, concerns, or complaints, or think the research has hurt you, you can talk to the research team at this number, or contact someone from the UMass Institutional Review Board at the phone number or email listed here. Thank you for taking the time to review this presentation. Please click here to complete a brief survey.